Well, diabetes is diagnosed by having high glucose, and glucose is a form of energy, and many cells can't protect themselves against excess energy. And the cells that can't are the ones that could lead to diabetes complications, so eyes, kidneys, blood vessels, nerves, feet. Our treatments for diabetes have actually improved steadily over many years. So the outcomes per person with diabetes now are much better than they were 30 or 40 years ago. So an individual with diabetes has a lower risk of blindness, kidney failure, amputation than in the past. The problem for the healthcare system is there are a lot more people with diabetes. So the absolute numbers of people going blind, having kidney failure, having amputations are getting bigger. It's a number of factors. So increasing age of our population as people get older, your risk of type 2 diabetes goes up. Increasing size of our population, because as you get bigger with more fat on board, especially fat in the stomach, you get more prone to diabetes. And less exercise. So the less exercise you do, the less fit you are, the more prone you are to getting type 2 diabetes.
Once fat gets into the liver then also increases insulin resistance, which ultimately leads to the development of diabetes. So liver fat is a very powerful predictor for the future development of diabetes. And ultimately, I guess if you develop diabetes, then you get cardiovascular disease, heart disease, and kidney disease.
The main cause of kidney failure worldwide now is diabetes, and the incidence of diabetes is increasing alarmingly, and therefore kidney disease is increasing as well.
Obviously, the simple fix is to lose weight and exercise, but it's much easier said than done. Despite everyone agreeing it's a good thing, over the last 20 years, Australians have only become more inactive and their weight gain has increased. So I think what we all recognise now is that the commonest cause of death is from chronic non-communicable diseases that are related to lifestyle. And essentially that comes down to obesity and lack of exercise. And the consequences of both of these is an increased risk of diabetes, liver disease, heart disease, and kidney disease. So it's essentially a multi-system disorder that starts off with our unhealthy lifestyle that we currently have.
We're increasingly concerned that diabetes and the complications of diabetes will actually break our healthcare budget if we don't do something soon.